Hello, I'm Dr. Tan. I'm a consultant neurologist in Pantai Hospital Ipoh. So today I would like to share about what happens after a stroke. So after a stroke, some stroke survivors experience significant disabilities, such as a difficulty in speech, memory, walking, and performing daily activities. However, this is not the end of the road. Our brains and the body need time to heal, and recovery varies from person to person. So some regain ability quickly, while others may require longer rehabilitation and support. The first 6 months after a stroke are considered the golden period of recovery, when the brain is most responsive to healing and relearning. That's why early and consistent rehabilitation is so crucial. The sooner it begins, the better the chance of regaining function and independence. So now I'm going to share regarding the rehabilitation journey. Stroke recovery is a journey that takes time and patience, and every small step counts. It involves a team of experts who work together to help patients get better and live as independent as possible. And this team including physiotherapists, which help the patient to move their arms and the legs and prevent contractures. Occupational therapists teach how the patients to go back to the daily activity so that they are independent in terms of the daily activity. And the speech therapists help the stroke patient in terms of the speaking, swallowing, understanding all the words, and improve the swallowing ability. All these specialists work hand in hand to support patient recovery and help them live a better, more confident life after a stroke. Not only that, and just as important, the family member and the carers play a very important role in terms of a stroke survivor recovery. Their patience, their encouragement and support make a word totally different. A kind words, a helping hands, and just simple being there lift the spirit of a stroke survivor and keep them motivated through ups and downs during the recovery. So now I'm going to share regarding the concept of a neuroplasticity, which means the brain powers to heal after the stroke. So the concept of neuroplasticity means that after a stroke, a certain brain cell dies. So the reviving brain tissue will take over the task of the dying cell in order to improve the disability. Through neuroplasticity, it can form a new connections and relearn the lost skill. And with the right training and environment, the disability will be or may be much improved. Every small improvement matters and every effort counts. Subsequently, I would like to also share regarding what we'll be expecting life after a stroke in the stroke patient in terms of the quality of life and mental health. Recovery is not just physical, but it including emotional and mood as well. Many stroke survivors experience the feeling of a sadness, depression, anxiety, and frustration, especially when everyday tasks become more difficult and harder for them due to the disability. All these feelings and emotion is normal and help is available. That's why emotional support and the psychiatric care is so important. Psychiatrists and the psychologists can provide counseling and medications when needed, and not to forget the support from the family, carers, as well as the support group is very important in terms of the helping stroke survivor in looking into their emotion and also listen to them. Connecting with other stroke survivors and talking openly about your emotion can make recovery better. With the right support, many people go on live independent, fulfilling, and meaningful lives after a stroke. So today I'm going to share regarding preventing a second stroke. So after a stroke, staying healthy and preventing another one is just as important as the first recovery. Follow-up care is a key. Make sure to keep your medical appointment, take your medications as prescribed, and regular checks on your risk factor, including the blood pressure, sugar control, as well as cholesterol control. Simple and healthy lifestyle can make big difference too. Eat healthy with a healthy lifestyle, more fruits, vegetables, less oily and fried stuff, including high cholesterol foods, should be avoided. Stay active, make sure to always get adequate exercise, as well as quit smoking and limited alcohol. Every small step towards a healthier lifestyle brings you closer to stronger and safety recovery. So in the end of the day, a stroke may change your life, but it doesn't take away your strength, your courage, and your hope. With early rehabilitation, family support, and all the wills to keep going, recovery is real. Together, we can rebuild life one step, one word, one smile at a time.